Every year, there's an estimated 3.8 million concussions in the United States alone, and most are classified as mild. But there's nothing mild about symptoms that hijack your focus, memory, and attention. New research explains how even mild concussions can create real, lasting negative changes in the brain, and here's what you can do about it. If you're new to my channel, I'm Dr. Brody Miller, PhD in brain injury rehabilitation science, best-selling author, and brain surgery survivor. And I help high-achieving professionals, athletes, and entrepreneurs reduce brain fog and overwhelm after a concussion. In traditional medicine, a mild TBI refers to the severity of the impact, but it does not guarantee mild symptoms or a quick recovery. In fact, large cohorts and studies show that people who have normal brain scans can have symptoms that last up to months and even years. So you're definitely not imagining it. Even though someone may look fine on the outside looking in, if you dig deep, key networks like the default mode network are severely interrupted in how they connect and communicate. Psychological recovery is not the same as neurological or biological recovery. And in fact, PET scans show that microglial activation, a clear sign of neuroinflammation markers in the brain, activate and go up. These markers can persist after months, even years after an injury. Translation, even though you're back and functioning like normal, underneath, there still may be lots of issues going on in the brain. So here are some general recommendations of what to do. Of course, not medical advice. Tip number 1, get lots of rest. Your brain's gonna need it. But also, 2 to 3 days after you or a loved one has experienced a concussion, perhaps get some light movement to boost blood flow in the cognition of the brain. And I also want you to track your triggers and symptoms up 10 days up to as long as it takes to see what's going on. Tip number 2, start to train the networks, the different networks of the brain, things that have to do with vision, hearing, focus, smell even. This is going to give you multisensory activities to start to stimulate different areas of the brain and heal it faster. Of course, don't overdo it. Tip number 3, try to drastically reduce neuroinflammation in the brain. Things like omega-3 fatty acids and turmeric are great supplements you can take to do so. And you can also do your best to reduce stress levels and only push up to the stress that you can take that doesn't set you back too quickly. And tip number 4 is join a community that understands what you're going through and work with somebody who actually specializes in concussions. Unfortunately, most medical doctors get very, very little training in concussion research, so seek out someone who understands what you're going through and can help you. If you're sick and tired of being told that your mild concussion is no big deal, then I invite you to join my REBOUND recovery community for a 14-day free trial where we do breathwork, meditation, nutrition, and cover many brain health targeted exercises that will get you better quicker. Click the link down below to join. To recap, even mild concussions can cause lasting impact in the brain. And the key is not to ignore symptoms, but to take proactive steps towards a healthy recovery. Thank you for your attention and time, and we'll catch you on the next video.